Hey guys, Reba here at Oregon Health and Science University, working with Foundations of EM to bring you some Airway content, as well as Dr. Andrew Perrotte out of University of Kansas and Kristen Graybo-Moore out of Emory University. And today we're going to be talking about every ER doctor's favorite tool, the Bougie. So if you guys are not familiar with the Bougie, this is pretty standard. They're usually these little blue guys with this little firm tip on the end. The rest of the Bougie is actually moldable, so it holds a little bit of memory when you bend it and manipulate it. We're going to talk about a couple pearls and pitfalls here. Basically, this is used in place of your stylet. So you're going to take your stylet out of your ET tube, and you're going to load your stylet onto the Bougie instead. You can do this before or after it goes through the cords. There are different schools of thought on this. Neither is right and neither is wrong. But I'm going to show you guys how this works. If maybe you don't have an assistant, you probably want it preloaded on the Bougie. I'm going to use my Mac blade here. I'm going to go in and sweep the tongue over to the midline. I'm going to get a nice view because my patient is well positioned on this pillow. ET tube is preloaded on the Bougie. And if I think it's going to be tight or I'm having difficulty getting into the airway or just if I want to practice, I might choose this Bougie. And this little curved end is going to pop right through the vocal cords. It's going to kind of bounce along the tracheal rings, and that's how I know that I'm in. And then you're going to just feed your ET tube right over top of it. Similar to like a Seldinger technique, you're using the Bougie almost as like an access wire. One of the things I want to caution you guys of first is the Bougie does have memory, like we mentioned, so don't overcoil it. If you coil your Bougie up like this, which I often see people stand there with it like this before they try to use it to intubate, it's going to be way too coiled. So you just want to take it, put a little curve in the end, just like you would your malleable stylet, and that's going to help you get a little bit more anterior into the airway. All right, guys, so we just went over the one-person approach. I'm going to tell you about the one downside of that is that if I have to pass my own ET tube, what I have to do in order to do that is take my blade out and pass this myself. That can be difficult if you have a patient with a large tongue or the tongue just falls back and obstructs where you're trying to get the ET tube to go. So quickly, I'm going to show you what's probably more common in most academic settings, which is the two-person approach. This is also a pretty long and difficult to maneuver little piece of equipment. So what you can do is take the back end of it, fold it over in your hand so that you have more control. And as long as you have a second operator, you're going to go in and get your view. You're going to pass your Bougie right where you want it. And then you're going to let go of the end of your Bougie while maintaining your view. And then you're going to maintain that view until you see the ET tube pass. And then you can take your blade out, and you or your assistant can pull the Bougie up. All right, guys, we're over here at the glide scope now with our Bougie to show you guys what it looks like upon placement. So we're going to use our Mac blade, and as always, I am at an academic center, so I have an assistant to do a two-person Bougie technique. So I'm going to hold it wrapped up into my hand so I have a little better control. Mac blade goes in the right side of the mouth, sweeping the tongue to midline, slowly going in until we see that epiglottis, which I've already passed up. And then we're going to lift up and get our view here. Bougie comes in the right side of the mouth, right down the trachea. I feel it bumping down the tracheal rings. It's gone a little ways in, so I'm going to let my assistant load that ET tube. And then I'm going to pass that tube myself under direct visualization. It goes nice and smooth. And then once I see it go through, I'm going to keep that view till the Bougie is completely out of the way and we know that the cuff is still below the cords. And then we'll blow up the tube.